Small amounts of silicone can leak from any breast implant without the shell actually being broken. It's called gel bleed, and it's like a diffusion, if you like, of small amounts of silicone across the shell of the implant without the implant having a hole in it. That can occur with any brand of implant. It's been suggested that this might occur slightly more frequently with PIP implants than other implants. There's no hard evidence of that. If you have a significant amount of this gel bleed going on, that'll be picked up on an MRI scan. Because lots of women in Australia are now undergoing MRI scans, and we would recommend any patient with PIP implants does have an MRI scan, we will find out whether the rate of that kind of leakage is higher or lower with PIP implants than it is with other implants, because that can be picked up on MRI scans. When any implant leaks, it can cause an inflammatory reaction in the tissues around the implant in the breast. That can happen with any brand of implant. The question is it more likely to happen with PIP implants if they rupture, and is the inflammation going to be greater? And there's no evidence that that occurs. The French did a test on some rabbits where they injected PIP gel into the skin of the rabbits, and they said that it caused a bit more irritation than normal silicone gel. There were some concerns about that test, whether or not it had been done in the proper way, and so the Australian TGA repeated that test here in Adelaide on Australian rabbits, and it was entirely normal. But they weren't satisfied with that. They then sent the samples overseas to France, to the very same French laboratory that had performed the French test, to see whether it confirmed the results, and it did. Those tests were entirely normal as well. So this means the evidence is that the gel in PIP implants doesn't cause any more irritation if the implant leaks than other medically approved gels.